One of the things that's very intimately related to eyelid surgery is brows, because a lot of times people will come in going, my eyelid's gotten really heavy, and when you lift the brow, all of a sudden the eyelid is not so heavy. So those are so closely related, because the more the brow droops, the heavier the eyelid becomes. So it's important to evaluate both of those when we're looking at eyelids or brow surgery. And brow surgery has advanced very rapidly in the last 20 years because, with the advent of endoscopic surgery. We now perform brow lifts through tiny little incisions in the hairline where we can release the forehead and lift it without any big incisions anymore. We do it internally. I use very delicate instruments to release the forehead. We use an endoscope to observe that to make sure it's symmetrically released, and then we can hold the brow into position and it'll seal down with incisions that are so small your hairdresser can't find them. Even at a week when we take out the little stitches hidden in the hair, it's hard for us to find them sometimes. So this has been a big advance because it's a very quick procedure, less swelling, less bruising, less sensitivity of the scalp with this procedure. So here's a patient again that has some aging changes around the eyes. Well, you can see that it's wide through the nasal bridge. There's some extra folding. You can see that she has a lot of wrinkles at the outer corner of the eye. So very small incisions in the hairline. We release the forehead, slide the forehead up, and given her a really nice rejuvenation of the eye area just with lifting the brow. We've smoothed the nasal bridge. We've eliminated these creases at the corner. Nice arch back to the brow. That brow fat pad is back up on the bone. That gives us a very nice contour there that you don't even see here because it's hidden underneath that fat pad which slides down over the bone. So lifting that tissue up back on the bone gives us that nice contour in that area. And another woman, a slightly more dramatic example. You can see all these creases here. The brow has collapsed. The eye has collapsed here, giving us creases at the outer corners of the eye. So very small incisions, releasing the forehead and lifting, smooth the brow, and she had a laser to tighten and smooth the skin as well. But this gives us a very nice and complete and natural rejuvenation of the eye area. And often when we do a brow lift, we don't even need to do any eyelid work because that removes that extra skin and improves the whole eye area without even removing skin around the eye.